Welcome to Bariatric Business Accelerator, the podcast created for busy weight loss practitioners and their teams who want to systematize, simplify, and accelerate the growth of their new or existing weight loss practice or program. I'm your host, Carol Clark, and today we are talking about some of the bonus structure ideas for nurse practitioners and PAs in your weight loss practice. I bring these topics up because they are questions that I am getting asked on a regular basis by clients that I work with or those people that are in membership. So just like you, when you're creating content for your patients, you want to listen to what it is that people are concerned about, asking about, and then be able to share that in a broader manner. So for me, this is a question that comes up because we want to make sure, of course, that if we have great team members, that we have the ability to lower any potential turnover rates. We want to keep them engaged in our practice. We want to keep them a part of the whole overall vision and happy. So part of that is compensation. And so having a bonus structure in place can be very helpful. There are 3 different caveats or things for consideration before you decide to move forward with this. The first one is making sure that whatever it is that you're going to offer is not going to end up being a negative in terms of profitability for your practice. So we don't want to be putting something in place that's going to end up being counterintuitive, so to speak. The other thing is that you want to make sure that you have consistency between your weight loss practitioners. Those that are your extenders, we want to make sure there's continuity, because why we think that they don't, but people do end up tending to talk at times. And we want to make sure that we are fair and consistent with that. And my third caveat or consideration for you is to make sure that whatever it is that you're including in any bonus structure is something that is not just a regular expectation for that particular person. So we want to make sure that this is a little bit going above and beyond and ensuring the success of your patients, your team, and your practice. So having said that, I'll go through some of the most common ones that I see. The first one for a bonus structure isn't really a bonus structure at all, which may sound odd, but it's for a lot of practices, depending on the size of your practice, you may just do bonuses when you're able to. You see a profitability, and so you want to thank everyone that's in your practice. And so you may do it as a surprise thing for your employees. And in that way, it's really great because people are surprised. They feel very appreciated. And of course, you want to do that when you can. So for the most part, that's at least once a year. Sometimes it's more often than that. But that way, it doesn't kind of require you to be locked into something. You are able to do that and are gracious to your team members when and if you can. So that's one thing. The other different mechanisms that I have worked with practitioners to put into place and utilize some in our practice as well over the years is patient retention rates. So seeing that patients are coming back and that they're happy. You can tie that also to patient satisfaction surveys for your team members, because you can have those come back specifically. There are some larger institutions that require a certain percentage or a certain number of patient satisfaction surveys to be returned, putting the onus on the practitioner to make sure that those are coming in. That's something that some people do, but anyhow, that's one measurement that you can utilize. You can also focus on something that you want to improve, if that's a metric, and you can change them over time, but that's one of them, which relates to patient retention, patient satisfaction. The other thing you can, I don't say this really very often at all because it's a little bit subjective in terms of the patient, but that's patient outcomes and overall weight loss, overall resolution of comorbidities. You can use that for a bonus structure, although I rarely see that utilized as a structure. The most common one is productivity based and profitability based. So this is where, from a budgetary perspective, we do lots in membership on finances and projections and setting up your metrics and all that sort of thing. But we want to make sure that we are tracking our extenders in their own cost centers so that we can see what the costs are associated with them, and also we can see what revenues brought in. Some practices, particularly those in hospitals, will utilize RVUs for this, and others will use true profitability. But anyhow, looking at their productivity, making sure that they are seeing the required number or above number of patients that you want them to be seeing per day. But a lot of times it's tied specifically to the profitability of their cost center. The other one would be perhaps some professional development. Maybe they're doing some extra things in your practice, so you want to compensate them for that. If it's not an expectation of their job, it could be some team training, patient training, classes. It could be doing additional videos, marketing. There's lots of different things that people can use that sometimes they'll use as a development sort of a thing, but they'll compensate them a little extra for that because it is outside the typical scope of their role. And then one other one would be patient referral rates. So making sure if they have someone who's getting a lot of patient referrals because they're so happy with the care that the practitioner gave them. Of course, your entire office plays into that. We want to be careful of that. But these are a variety of the ways that people will structure this. Oftentimes, like I say, the most common are either just bonuses when you're able to. The other one is based on volume. Or patient satisfaction, and then as well as probably what I see the most often is productivity or profitability based on their particular cost center. And you can do that just, I've seen it done so many different ways, so we could talk about that individually, but anyhow, that's what I see. So I hope you found this helpful. Remember my considerations at the very beginning. The one thing we don't want to do is put a bonus structure in place for the common expectations of their position anyhow. It's for something above and beyond, but there's lots of different ways that you can do that. Make sure that you are consistent and that in terms of other providers, and make sure that whatever you're offering as a bonus isn't something that over time is going to end up really poorly affecting your bottom line or your profitability. So there you have it. If you have questions, reach out to me, Carol, Karol, at weightlosspracticebuilder.com. Lots of free resources at weightlosspracticebuilder.com, and also a way to subscribe to my weekly e-newsletter. Easy to digest business and information for your practice, your team, and just lots that's in there. So anyhow, I hope this was helpful, served you well, and I will talk to you soon. Thanks.